Well, Mark, congratulations on earning the designation. And of course, thank you for finding the time to talk with me about it.
Well, thank you for taking the time to talk to me. I appreciate that.
Yeah, well, comprehensive designation. That's in the fastest pace possible.
Yeah, it's exciting. It's exciting for us. I mean, this is something that certainly has been a goal for me and my team. I mean, ever since we got NCI designation 10 years ago, we were immediately setting our sights on wanting to be better and bigger and comprehensive. So this has been 10 years in the making.
Yeah, well, which is the fastest it can be done.
Yes, sir. Yes, sir. That's correct.
Yeah. You know, I love asking this question because Joe Simone is such a visionary. He used to say that when you've seen one cancer center, you've seen one cancer center. How is Kentucky Markey Cancer Center different from all the others?
Yeah, so that's a great question and something that I could probably expound upon for hours, but I'll try to be concise. So several things I think really set us apart. I mean, there's a huge community focus at Markey. This is something that's been ingrained in our DNA, so to speak. I mean, Markey, the genesis of the Markey Cancer Center really started out in 1975 as the McDowell Cancer Network, which was totally focused on cancer prevention and screening to our Eastern Kentucky Appalachian population. So again, those were the early roots of the eventual Markey Cancer Center. So the community focus has been something that has been, you know, front and center for us for 50 years, really, as a cancer center. So I would say that that's one, you know, the collaborative nature of our cancer center. I mean, everybody enjoys working together. We enjoy, you know, bringing new people onto the team. I mean, for example, our campus here, all 16 colleges are on the same footprint, which makes it quite exciting for collaborations. We have a very strong College of Pharmacy, Agriculture, Public Health. I mean, you name it, nursing is very strong. So finding collaborators in those colleges is really quite exciting. And, you know, I think the last thing that really, I think there are a number of unique aspects of Markey, but sort of the way that we span throughout the state, I think with our affiliate network, that's really become a model that other cancer centers have come to us to try to replicate, so to speak. I mean, we have 19 affiliate hospitals that really span the entire state from far eastern Kentucky to far western Kentucky. And, you know, these are not only clinical connections, but they're research connections, cancer prevention. We do joint cancer prevention and screening efforts with those affiliates. And so that's, I think, has been a model system of how you impact. I mean, Kentucky is predominantly a rural state, so being able to have those affiliates to increase your access has been hugely important.
Mm-hmm, mm-hmm. You mentioned the 50-year history. Who started the predecessor institution? Who ran it? Who were some of the folks who ran?
Well, so Gilbert Friedel was a very important figure here. He was passionate about the Eastern Kentucky population. Really, I mean, we stand on the shoulders of giants in many respects because he really cast a wide shadow and he really started a lot of our outreach activities back in the 1980s.
Yeah, I talked to him pretty often.
Yeah.
Fascinating. He came to Kentucky from somewhere else.
I don't remember where exactly Gil came from, and but again, a huge influence in terms of shaping the way that we are today.
Oh, interesting. In what way? Is there anything you can remember about Gil? Because he's someone we should probably profile in the Cancer History Project.
Absolutely. Unfortunately, Gil has passed away a couple of years ago, but just the passion that he had for the Eastern Kentucky, the problems in Eastern Kentucky, which are quite significant, as you know, and the outreach that he really established to those communities, again, has really been the bedrock in terms of how we've approached those communities, and it's really helped to establish that nidus a focus for that particular population that has such great health disparities.
Yeah, could we talk about the population? What is your catchment area? What are some of its characteristics?
We're the only NCI designated cancer center in Kentucky. So we consider the entire state as our catchment population, which is about 4.4 million people, 120 counties, 41% rural population. And some of the problems that we deal with in terms of this population includes poverty, low education attainment, the high smoking rate, higher obesity rates, and really the rates of cancer are extremely high in the central Appalachian population of Eastern Kentucky and Western West Virginia. So again, a lot of health disparities within that population.
And a lot of it is occupational too, right? I mean, coal mining and so forth.
Well, there are some occupational hazards that they're environmental exposures, but that's throughout Kentucky as well. I mean, that's due partially to our geology. For example, radon exposure is a major factor in Kentucky due to the limestone geology. So a lot of factors sort of, it's the perfect storm, so to speak, in terms of some genetic aspects, environmental aspects, and just, the influences of poverty and smoke and obesity.
And this is the highest cancer rates of any state, right? Is that pretty much correct, or
yes? Unfortunately, I mean, I think Markey, I know Markey is making a huge impact. We've made a huge impact over the last 10 years, but yes, we still unfortunately have some of the highest cancer incidence and cancer mortality rates in the country, particularly concentrated in that one population.
Can you cite that? Do you remember them by heart?
I'm sorry?
The rates. What is it? What are the cancer rates in Kentucky?
Well, so we're still number one in lung cancer incidence and mortality, unfortunately. We've dropped down a little bit in colorectal. Colorectal has high incidence and mortality rates. I don't remember the exact numbers. Head and neck cancers are within the top 10 in Kentucky, and so is cervical cancer.
Wow, cervical cancer.
Yeah.
Yeah,
yeah. A lot of a lot of our work obviously is driven by all of these factors, these high cancer risks, et cetera. And so a lot of efforts regarding HPV vaccination, particularly in our rural populations that Markey is doing. So a lot of things that Markey is addressing to try to really decrease these terrible numbers.
Yeah. What is the number of patients that pass through? What's the index cases number for you?
Yeah, so we've doubled actually in the last 10 years. So it's up to around 4,100, 4,200 new cancer cases per year at Markey.
Wow.
But it's interesting that either through Markey or through one of our 19 affiliates, the Markey network takes care of or sees about 50% of all new cancer cases in Kentucky, which is quite significant.
Yeah, and the rest go to private.
Yes.
Yeah. Oh, fascinating. How do the needs of your catchment area determine your research agenda?
Yeah, great question. I mean, everything we do at Markey and as with other NCI cancer centers is really based upon strategic initiatives. So we at Markey, I mean, we are not a huge cancer center. We're still, on the smallish side, a matrix cancer center. So I think it's really important to focus because, again, we can't be everything to everybody. So really focusing on the huge needs of our catchment population. And we, Dr. Pam Hall, who is our Associate Director for Population Science and Community Impact, and her team really did a very thorough cancer needs assessment a couple of years ago, helped us to, focus on our major research priorities, which include some of our signature cancers, lung cancer, colorectal, head and neck, as well as some of our risk factors. We've got active programs around tobacco cessation, et cetera, screening, lung cancer screening, obesity, and then HPV was identified as a huge need as well. So yes, I mean, that really drives the focus for our research, is really based upon those community needs.
Well, you got to from zero to comprehensive designation as fast as humanly possible. How did you do it? What did your war chest look like? How much money did it actually take?
Yeah, so great question as well. And I have to say that we have outstanding team. I mean, everybody has bought into the mission. They understand the mission of Markey and the dire problems that we face. So I'm not just talking about our Markey team. I'm talking about our affiliate network. I'm talking about the community. The state has been wonderful partners in the institution. So we've had tremendous institutional, state, and philanthropic support. And if you look at it, since I came in 2009, and it would include this current 5-year period that we're in to fiscal year 2028, I think we totaled up, and it was somewhere north of $1.2 billion that's been put into the cancer initiative. And that's major recruitments, that's been buildings. We've needed more research space, and we've got ongoing construction for a Markey Advanced Ambulatory Center, which is going to be fantastic, transformative for our population. We'll co-locate all cancer services in one building. So tremendous amount of support, but really all players have stepped up to the plate, so to speak, and we've really enjoyed tremendous support from all parties.
Well, 1.2 billion over.
Yeah, over, that would be a 15 to 18 year time span, but that's what has been needed, to really recruit the people that we needed, as well as for facilities that were badly needed too.
Yeah, because I always thought Gil Friedel was talking about how underfunded things were, and then I guess the funding came.
No, we've been extremely well supported, very well. Yes.
Legislature.
Absolutely.
How does the legislature just is there some sort of an annual
Right. So Markey gets annual funds that really go for research screening. We get help with our cancer registry, for example, and many of our outreach. And I have to stress that this is a bipartisan effort. Most recently, the state legislature approved $20 million additional dollars for Markey over the next 2 years. So I was very grateful for that as well.
Well, you mentioned that you're starting to see the metrics improve. That's fantastic. And in what way are they improving?
Yeah, so several ways. So if you look at where we were with colorectal cancer screening as a state 15 years ago, 20 years ago, Kentucky was 49th in the US. We're now up to 20th, which we still have a lot of work to do. But to think that we've made that sort of improvement going from 49th to 20th over this time span is a real testament, I think, to Markey's leadership in that regard, working with our state partners. So we've seen we're no longer #1 in colorectal cancer incidence and mortality. Now we're still high, we're still within the top 10, but we've seen those numbers decrease. And another thing that I'm really proud of is our lung screening initiative. I mean, you think about it, Kentucky has a 200-year history culture of tobacco production and tobacco consumption, but we're currently the #2 state for lung cancer screening. I mean, we're just behind Massachusetts, which to me is amazing. That we're making that kind of progress. And what we've seen is that the number of late-stage lung cancer diagnoses have come down. We're seeing those cancers, we're still seeing the cancers, but we're seeing them at an earlier stage, and more treatable stage. So I'm really proud of that, because culture is sometimes a very difficult thing to turn around, so to speak.
Yeah, and lung screening is a really intrusive and invasive,
right?
So, and with lots of resistance to it. So yeah, Can we talk about your career path? You mentioned you came to Kentucky in 2009. What brought you in? Why did you decide to go there and take this job?
Yeah, wonderful opportunities, I have to say. I mean, I'm a surgeon. I'm a surgical oncologist. So I'm from Tennessee originally, and I did my surgical residency at the University of Louisville, and then went down to Galveston, Texas, University of Texas Medical Branch for 20 years, where, the last 5 years or so of that, I was director of our smallish cancer center. It was more of a research cancer center at that point. But I found it very rewarding to put together multidisciplinary teams. That's really what I enjoy doing. And when I was called about this opportunity in Kentucky, I saw all the great resources and all the great people that were already here. So I saw that as a real opportunity to come in and hopefully make a difference.
Mm-hmm, mm-hmm, mm-hmm. And so in 2009, you become the director.
Yes, sir.
Yeah. So what was the heaviest lift on the path to designation? What was the hardest thing to do?
Yeah, I'm going to give a totally boring answer to you.
Oh, hey, we had the cancer letter. We love boring answers.
I've been so fortunate and blessed, I think, as Cancer Center director here, because there have not been some of the traditional heavy lifts or stumbling blocks that sometimes I talk to colleagues across the country that there are issues with institutional support or state support, or philanthropic support or whatever. That has never been an issue here. I mean, we've been supported very well. I'm very fortunate in that regard. And then also the team was anxious to come on board. Again, as I mentioned, it's a very collaborative place, so we enjoy working together. And everybody was bought into the mission that this was patient-centric and community-focused, and this is something that we need to do for Kentucky. It was a lot of work, don't get me wrong, but I don't feel that there were stumbling blocks or anything like that in our way.
No, I wonder how much population science you had, for example, in 2009, because population science is so crucial to what you do. Was it there?
Oh, absolutely, it was there. And again, credit Gil Friedel and a lot of his efforts as well. But population science, I mean, I was as cancer center director when COE became a component for NCI, reviews. I was ecstatic. I think I did a backflip or whatever, because I mean, we already had that in spades.
You needed to just improve the programs, but the programs.
Right. We need to coalesce better, and we've added more people, but we were already at what I consider to be a really good stage. And, I'm biased, but I think we've got probably one of the best COE components in the country. I mean, that's just the way I feel.
Well, Gil was building it in
absolutely. He was building it in 1975, so or early 1980s. So again, kudos to him.
Are you worried about the political climate in the U.S. now? I'm talking about the Supreme Court rulings on affirmative action or abortion. Is that something that comes into your daily work?
Well, it's not. I mean, we're so focused. I mean, we understand the great value of diversity, a great strength of how we've been able to, as a cancer center, move forward so rapidly, is that we are so welcoming in terms of our teams. So we value the fact that folks come from different perspectives, different backgrounds, different disciplines. And we really are focused on those kinds of needs of Kentucky and building these diverse teams. Several programs that we have that have been really important that I think are unique. We have something called the Action Program that's now funded by an R25 through the NCI, but that's taking Appalachian students, undergraduates, high school students, and mentoring and helping them to progress in their careers. Again, these are some of these kids come from families of very destitute means, and so that program has been so wildly successful. I mean, we've had 30 kids now over the past 7 years who have gone to medical school. We have 4 of the kids who went to pharmacy school. In fact, one's a practicing pharmacist in far eastern Hazard, Kentucky, which we're really proud of. So being able to develop these pipelines, we also have something called a strong scholars program that is really mentoring and training our underrepresented minorities, and that's just been instituted the last 2 to 3 years, but wildly successful as well. So again, we cherish this, and we understand the value that diverse teams bring to our research and our care of patients.
But you're not worried about the current climate in any way impeding that?
I'm personally, I'm not focused on our needs and our community.
Yeah, it's also really often forgotten that cancer centers play a very, or should play a very important role in education, and that's what you do.
Absolutely, absolutely. Again, we value that. That's part of comprehensiveness, and you know, I appointed our AD of education, Dr. Kathy O'Connor, back in 2010, before that was even a component, you know, from NCI. So that's always been a really strong focus of Markey as well.
Well, now that you have the designation, what keeps you up at night? What worries you?
Well, I'm always worried, you know, as I tell, you know, I think that's the mark of a cancer center director, but certainly, you know, we see, as I mentioned, our numbers have doubled over the last 10 years in terms of patients coming, and we only see more of an uptick in patients over the years. And as I tell people, one of the proudest things that I feel about the Markey Cancer Center is the fact that no Kentuckian needs to leave the state now for outstanding clinical care and cutting edge research. But we need to continue to stay focused on hiring the best talent out there. And as you know, I mean, it's we're all competing for the same talent in terms of oncologists. And sometimes oncologists will go the private practice route or the industry route. So, you know, it becomes a continuing struggle to make sure that that you have the manpower to take care of the increasing number of patients that we're seeing.
How did you get through COVID? How did that affect you?
You know, we were not hit as bad as many parts of the country. I mean, we were quite fortunate in that regard. And I have to say, I'm so proud of this as well. You can tell I'm really biased.
Oh, you should be.
Giving you all the proud moments, but you know, we didn't miss a beat in terms of clinical trial accruals. In fact, our clinical trial accruals actually went up during COVID, and I think we're one of the few cancer centers that can boast that. Again, we were fortunate to not see the devastating effects of huge patient population with COVID as the New York area and some of the major cities, but still to actually increase your accruals during that time was quite significant.
Yeah, not many people did, if anybody. How about the clinical trials office? Were you able to maintain the workforce?
Yes. So, you know, I talked to a lot of cancer center directors, and that the impact of COVID is probably less than some of the retention issues that many cancer centers face, because some cancer centers lost 50% of their staff. I mean, maybe more, but we were able to retain our staff. I mean, we made efforts to upgrade their pay status, upgrade their grades, and our administration did a great job with that. But I have to say that, again, this is a group that has bought into the Markey mission as well. I mean, many of our staff are from Eastern Kentucky or from some of our vulnerable populations, so they see the impact of their work at Markey. So I think that was a major factor of retention as well.
But I mean, the deals that were being offered at the time were pretty great, because you could work from home and double your salary, and I guess and you kept everyone.
Well, I mean, we did have some attrition, but some attrition is normal. I forget, it was in the 10%, 12% range, which is fairly low compared to many other cancer centers. But yeah, I mean, we worked on getting their pay grade up during that time. But again, many of these, I mean, it's home. Lexington is, or Eastern Kentucky. So anyway, we were able to retain our top staff, which is fantastic.
Yeah, it's interesting because to quote Joe again, leadership matters and morale matters, and I guess that must be what you're really talking about.
Right, absolutely. You know, we've got great leadership in the clinical trials arena and morale. I mean, again, everybody's focused on the fact that their jobs matter, their work matters. They're seeing impact of that in Kentucky. So it's very gratifying.
Hmm, hmm. Well, is there anything I forgot to ask?
I don't think so. I think this is very all-inclusive. Again, I really appreciate you taking your time to talk to me. I'm always proud and honored to talk about Markey.
Oh, well, and thank you for finding the time. And again, congratulations. Comprehensive designation is the ultimate prize.
Well, it is, I guess, but it's not for us. I mean, we still have designs of getting bigger and better. And so as I tell our team, comprehensiveness is now that's ancient history. We've got to focus on continuing to be better and for our community and for our patients. So I don't consider it the ultimate. I mean, it's going to be the ultimate when we really make even greater strides to decrease incidence and mortality in Kentucky. That's going to be the best.
Thank you again.